There are reports that the FDA may soon grant emergency authorization to Gilead's experimental COVID-19 drug remdesivir. This follows comments from Dr. Anthony Fauci, who said that there is evidence the drug is effective.
That remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery. This is really quite important.
Shares of Gilead rising on that positive drug trial news that we got here on our air yesterday. Joining us right now is Dr. Gottlieb, Dr. Scott Gottlieb, the former FDA commissioner, who's also a CNBC contributor and serves on the boards of Illumina and Pfizer. And Dr. Gottlieb, we spoke with you yesterday about this coming out of it. If you were still running the FDA, would your decision be to push this through pretty quickly?
Well, I think it's going to get an emergency use authorization. I think the FDA is probably going to move ahead with that. This data set certainly meets the threshold, the legal threshold, for allowing the drug to be authorized to be used in the setting of a public health emergency right now. The drug showed an improvement in time for hospitalization from 15 days for the untreated group to 11. That's a significant improvement. It also showed a trend towards lower death in the group that received the drug. And a lot of these patients were pretty sick patients. In a setting where nothing else is available, the drug seems to meet the legal standard for an emergency use authorization.
Scott, let's talk about some of the other comments that Dr. Fauci made yesterday. He said that a second wave is probably inevitable, but that the White House is not going to extend the stay-at-home orders at this point, that we're looking at the end of really being locked down, at least across the country.
Well, I think it's probably the end of the federal guidance to the states. I think the states are going to make individual decisions still. We still face a pretty big epidemic in this country. The slope of the curve down isn't steep. We're really on a flat part of the curve right now. We've plateaued, but we haven't seen the declines across the country that we were expecting right now. And that's similar to what happened in Italy and Spain. They went up their epidemic curve quickly, but then it took a long time to come down that curve. It wasn't a symmetric curve like it was in China, where China went up quickly and then came down quickly. So if you look at states like Massachusetts, Illinois, Maryland, Indiana, Virginia, Colorado, Tennessee, North Carolina, those states are still increasing in terms of the number of new cases. In fact, there's 25 states in all where the number of new cases on a daily basis are going up. There's only about 6 states where they've shown sustained declines in cases, Ohio and Idaho being 2 of them. We've also seen declines, obviously, in the Northeast. So a lot of the country is still experiencing a pretty broad epidemic. So the states are going to have difficult decisions to make in May. And I'll just pause here by saying, you heard Elon Musk's comments. I think that reflects a growing sentiment in this country where people want this to be over. And so that's going to tug against what the governors have to do. They have tough decisions to face this month.
What do you think? Why do you think the cases aren't coming down? Are we not following the guidelines closely enough?
Well, I think that's right to some extent. The IHME model and the other models were predicated on a symmetric curve. The way that those models were built, because they were based on the data out of China, they assumed that the slope of the curve up the epidemic was going to be similar to the slope of the curve coming down. And in fact, what we've seen in European countries is the slope is very gradual coming down. And that's in part because of leakier mitigation steps. People haven't been following the mitigation as strictly as what they were able to accomplish in China. And I think we're leakier here in the United States. And so we're likely to have an epidemic where it's a very gradual decline. And so the risk isn't that you don't have the tools in place come May to reopen the country. We talk about screening and case-based interventions. We won't have all those tools in place. I think the bigger risk right now is we reopen while we still have a lot of smoldering infection. And so we never quite get rid of it. It just continues to smolder all through the summer. And then we face combustion in the fall. We face the risk that, it starts to reignite again in a far more robust fashion when things are kicked into high gear in the fall in terms of work and school and residential college campuses. I think that's the concern. That's the risk that we face here.
Doctor, there's a group on this has gotten to where people are divided, obviously, and Elon Musk is one place. But there are a lot of people in the country that talk about what we're trying to do, and I'm not saying either side. I'm not taking either side, but there are some that say this was about bending the curve so that we didn't run out of ventilators, and that once you do that, you're not going to prevent some exposure of the entire country to COVID-19. Right. And you couldn't be in a lockdown for 18 months till there's a vaccine. So once you once you have prevented people from being able to get the care that they need, then there's going to be some spread that eventually ends up with some type of herd immunity or something that makes it not quite as horrific when there's a wave or something. You know what I'm saying? That there's people that say, look, this is going to move through the population.
Yeah.
And there's a lot of elderly people, obviously, that are at risk, that we need to definitely protect and care and make sure they get the care that they need. But you're never going to go to zero by keeping people locked up in their houses waiting for a vaccine. Right, Doctor?
No, look, you're right. You're never going to go to zero. We're always going to have spread on a daily basis, and we're going to need to learn to live with it. And the drugs that are coming online will hopefully mitigate the risk. But just keep in mind, let's assume 20% of New Yorkers have had COVID-19, and that's probably a high estimate, but let's just assume it. Look at all the morbidity and mortality in New York. Look at all the death and disease. We had refrigerated trucks outside hospitals. So now you take that 20% and you increase it to, let's say, 30 or 40% because you're not taking mitigation steps. And now you apply that to every dense population center in the United States. And you have to ask yourself whether we're willing to sustain that level of death and disease for purposes of not having mitigation steps in place. You know, right. I think we're going to have a tough decision to face in the fall because it's going to be hard to re-implement these, but we're going to have spread. And so the question is, what does the economy look like? Because there's going to be a lot of people who want to stay home and a lot of businesses who don't have customers in this setting where this is spreading pretty widely, and we've never really squelched the epidemic. And that's the risk we face here, that this doesn't really go away because we don't get rid of it this round, that the mitigation steps weren't quite robust enough, as painful as they were, and we continue to have spread right into the fall.
That sounds like the worst of both worlds.
Well, the hope is that we have a much better toolbox heading into the fall. That, you know, we're going to have testing stepped up. We need to do case-based interventions, track and trace. People now are criticizing that we shouldn't be, you know, isolating people who are infected and trying to trace a sick context. But if we can do that, we can really reduce the transmission. And then hopefully we'll have one or more drugs. Remdesivir is a drug that looks active. It's not a home run, but it looks like it can help. We might have the antibody drugs, and we may have a vaccine in doses sufficient that we could ring-fence major outbreaks in big cities in the fall. You know, millions of doses and maybe tens of millions of doses if multiple manufacturers make it over the finish line. So we may have a much better toolbox heading into the fall, but I think we face a lot of risk, especially as this collides with flu season.
Doctor, you know, you always talk in the most measured terms, and so sometimes it's a little bit actually hard to understand what your actual position is. And so just to come back to it, if you could help us, you know, what are you suggesting here? That the governors of these states are moving too fast? Would you be telling them that they should be shutting down or stay closed much longer? Is that the lesson of what you're trying to say? You know, I'm just sort of trying to get to the essential piece of what you think is supposed to be happening that isn't.
Yeah. I'm still in the camp that I think we should wait until we see sustained reductions in new cases on a daily basis for a period of time before we reopen the state government. So you look at states like Ohio and Idaho, and they're more or less meeting that standard. And so I think what the Ohio governor is contemplating is reasonable. They've shown a sharp reduction in new cases. I'd like to see it extend for another week. But it's reasonable for that governor to contemplate restarting aspects of his economy. But you look at states where the cases are increasing, like Massachusetts, Indiana, Virginia, Colorado, Tennessee. It's going to be very hard for those states to reopen. We're still seeing deaths go up. Deaths are a lagging indicator. We're seeing cases nationally bounce around 30,000. We really haven't seen declines yet. That's a pretty big epidemic. So I'd like to see the states take a little longer, the states where the cases are going up. I think politically it's going to be very hard for these governors because you're starting to see the fraying. You're starting to see people get restless, and rightly so. People are being badly hurt by this economy. So, you know, this is a very tough decision that these governors are going to have to face through May. I think every week that we get, we're better off in terms of the mitigation, but we're not going to get much further without having some real consequences on the back end of this.